You know, 1 in 8 women will develop breast cancer during their lifetime. And if it is diagnosed early through screening mechanisms, the prognosis is 99%. If it becomes metastatic, then the prognosis drops to only 29%. This should not be anybody's story, but there seems to be a consistent reluctance for screening tests. During this podcast, my goal here is to convince you and answer all your questions regarding breast cancer screening. In this live session, we will be discussing about risk factors for breast cancers, lifestyle changes which we could do to prevent breast cancer, latest research, screening, and treatment modalities for breast cancer. And in the end, we have compiled 30 questions from wide range of patients, internet research. And my goal here is to answer most of your questions about screening, treatment, prognosis, and new developments which are happening around breast cancer. Worldwide, in 2023, we lost 2.3 million women to breast cancer. In United States, there are about 42,000 deaths happen due to breast cancer. Let's do the math. It comes around one jumbo jet crashing every day from this deadly disease. This disease, if detected early through mammography, costs 10 to 15,000 per case because treatments are easy and the disease is curable. But if screening is ignored, then this can cost up to 100,000 to $1 million depending on the institution. So this is not something simple. There is a lot of family histories, racial background, social determinants of health, which determine the final outcome of breast cancer. We will answer all of your questions so that after this talk, you are able to understand this disease and make a reasonable decision with reasonable accuracy. Why we celebrate Breast Cancer Awareness Month? A, it is a very common disease. The goal of Breast Cancer Awareness Month is to start conversation or a dialogue for early screening, ensuring people understand the risk factors, and then coordinating all the efforts about best treatments and then collecting money for research and development. Third Friday of every October is also celebrated as National Mammography Day. We focus all the efforts so that we could increase your acceptance of this life-saving screening test. And I will convince you by the end of this talk why we should not ignore it. To kind of give you a context about this disease, let's start a conversation about what is breast tissue is, and I will explain you anatomy of the breast tissue quickly so that we could build what we're going to talk in coming minutes rationally. Breast tissue is made up of a gland which we call lobules, which produces milk. This milk is carried through the ductal system to nipple, where it's extruded out to feeding the child. This duct and the conducting canals are encased in a lot of fatty tissue, which gives breast its shape. So basically, when anatomically you look at the breast tissue, you need to look at breast tissue in following component. Let's start from outside, go inside. Outside is the skin, nipple. Then underneath is the fatty tissue, and the fatty tissue there are ducts, and then the glandular part of the breast tissue, which is supposed to produce milk. So when we talk about breast cancer, the sources where this cancerous change can happen, it could be either in the lobule or the gland which produces the milk, or it could be in the ducts. So that's why there are, when we talk about breast cancer, we talk about two kind of breast cancers based on ductal, the one which arises from the duct we call ductal carcinoma, and the one which comes from the lobule we call lobular breast carcinoma. There is, in the fatty tissue, we could develop a lot of fatty tumors, the lipomas, and then from the cycle, when scar tissue and the fatty tissue meet, fibrolipoma. Lot of ladies, if they have a dense breast, when they get the mammogram, they get those tumors reported. But with this background, let's understand what breast cancer is. Breast cancer, or rather any cancer cell, nature has a very coordinated way. When each cell divides into newer cells, it keeps in check how many times it can divide and how far it can, the process can keep on going. So it keeps the number of cell divisions under check. Second, each tissue maintains its boundary wall. When these cells start proliferating and not obey any rule or law, that is a one cancerous change. These cancer cells have a property that they keep on dividing and they do not follow the regular rules. Second, they have a increased ability that they could penetrate into adjoining tissues, organs, and they can metastasize from the originals, that they don't follow the boundaries. And by and large, these are the two main characteristics. My goal in this talk is to keep it simple so that we all can develop a narrative. So these cancerous cells can develop either in the gland or they could develop in the duct. So then all the breast tissue has lymphatics. They drain to axilla, and then they have the venous system and the arterial system. So whenever the breast tissue develop cancer, whether with the gland or the duct, it will first spread locally, then it has a propensity to go to your lymph nodes. And that is where the beauty of early screening comes in, because we need to tie up both the things together. If you go for your routine screening test, you will find these cancers at a very, very early stage, either located in the duct or located in the lobule or the glandular part of it is. And simple surgery, lumpectomy could be done, and you are done with the cancer and the cancer is cured. For you to feel a lump, it has to grow to a certain size before somebody develop a sensitivity to do that part. Even in the studies, we used to promote a lot of self-examination and also a lot of clinical examination. I still believe that we should continue to do that, but the sensitivity or this test, these procedures, whether you self-examine or a physician or a clinician examines, the sensitivity or the chances of finding this change in breast tissue at a very early age is very small. So that is why now the latest recommendations are rely on screening methods more than trying to say I self-examine, I know my body and there is no change. Or if clinician examines, those things have not test the test of time and there is a lot of missed opportunity. That's why we focus more on screening by mammography. Now, before we take on, let's talk about mammography a little bit. Or let's take what are the screening methods which are available to screen for breast cancer. Two we have already talked. Number one, ladies doing self examination. Number two is clinical examination. Next test and the best test for screening breast cancer is mammography. It is x ray of your breast tissue. It is uncomfortable, very understandable, but we all go through difficulties. This 5-10 minutes of discomfort yields so much of information that should not be the reason that you don't want to get it. In this, when the radiologist gets the pictures, they get the pattern architect of your breast tissue. And if you have the previous mammograms, they compare it and they could very, very reasonably explain you about whether there is any abnormalities in the breast tissue. Because these cancer cells develop calcifications, and those are very well picked up on those mammographies. Now, there is a new treatment modality, 2D mammography, which is available. This technology is improving. In this, rather than having a single dimensional view of your breast tissue, there is a two-dimensional view, and you will pick up pathologies quickly and more often with this technology. But unfortunately, this technology is developing. Mammography, we know the data for 50, 60 years, and the radiology eyes, when they also targeted with the computer readings, they are getting really good at it. But this 2D mammography is a future, I believe, but it's still maturing because it is dependent on the who's reading it, and there is a lot of little bit higher false positive rate that you may not have anything, but the machine will pick it up and you may go through unnecessary tests. So those that is the criticism of 2D so far, but it is improving and I believe it will be the future, but not today. Next test is the ultrasounds. Ultrasounds is a decent test, but it does not give the full picture. But in ladies who have very dense breast, that is a alternative and we can try that. Also the ladies who have breast augmentation and implants, that is one of a very good modalities because I've seen those ladies completely refusing it, and we have to really convince them that we could do ultrasounds and you should get something done. And the next modality is the MRI. Like the way I told you with the 2D MRI, 2D mammogram, MRI of breast is a very sensitive test. The sensitive tests are it overreads it. There are certain things which may not be pathological or may not be cancerous, but it will pick it up. So your chances of finding cancer diagnosis initially is a lot more, or there is a lot more false positive rate because it will overread it and you may go through the biopsy and you may find The test was not positive. Was no malignancy, but the machine read it as malignancy. So that's why its recommendations are the MRI of the breast should be done. A, if you're a cancer survivor and you're checking the problem, trying to find out if there is a recurrence or anything new going on, that is a good place to start because that sensitive tissue will pick up the changes happening very quickly. Or there is other treatment modalities which are inconclusive. The problem which we are going through as a primary care physician is the centers which have MRI and they are doing trying to develop the business out of it is they promoted as that this test is better than any other test. That's correct. This test will find more pathologies, but that may not be cancerous. So you may go through unnecessary tests. I truly believe you should talk to your primary care physician and make a kind of a shared informed decision. But as we are talking today, mammography still remains the gold standard and we should continue with that part. Now, who should get mammography? We used, and according to United States Preventive Task Force, we used to start screening mammography at the age of 50, and we did it till the age of 74. And the frequency kept on changing. As of today, it is recommended that if your two last mammograms were stable and everything, nothing has changed, then it's every 2 years. It is not yearly, but unfortunately, American College of Cancer Society has a different recommendation. Radiologists have different recommendations. As a primary care physician, we follow United States Preventive Task Force guidelines. That is a voluntary organization. Nobody's getting paid to come up with any kind of biased recommendation. It is evidence based. So, as per their guidelines, between the age of 50 and 74, you should get every 2 year, provided your mammograms have been stable. But if there is a problem, frequency could be changed and adjusted based on what your physician thinks. Further, between the age of 40 and 49, that's where we are getting a lot of questions these days. And they are recommending that it should be a shared decision making. If you are somebody who has a first degree relative who has a mammogram, or you have a genetic markers which are positive for breast cancer, or your lifestyle, which we'll go in a minute, you think you're at higher risk, it could be done between the age of 40 to 15 to 40, between the age of 40 to 50, and the frequency could be adjusted based on the shared decision making. One group of ladies who should not get a mammogram, according to the guidelines, is 74 and above. Because once you go above this age group, the false positive rate, all those things go very high, and there is no proven benefit of doing mammography after 74. Now, let's talk about the risk factors. Breast cancer risk factors are, we could start from genetic to our lifestyle. That's how every disease works. If you have genetic predisposition, you have BRCA1 and 2 genes, then you are at high risk of developing. But genetic predisposition is only in 8 to 10% of the families. Most of the breast cancers, and that is the irony, and that's one of the message which I want to convey is most of the breast cancers are in ladies who never had family history of any breast cancer. If you have family history, you are at high risk, but without family history, it's a very common and we find it most of the time. So the first is genetic, second is the family history, and third is your lifestyle. If you're obese, you didn't have children, each organ in the body is created for a specific purpose. If you've never been pregnant, or if you are pregnant, you didn't breastfeed the children, your risk goes up for breast cancer because the organ is intended for that part. Then high fat diet, all these things have been linked to you to be high risk. Now, we did a lot of research on this one is what can we do in lifestyle way? As I said, 1 in 8 women will develop breast cancer. So what are the lifestyle changes we could recommend? Number one is losing weight. And second is food. They have found consistently individuals whose food is primarily plant based, they have very high low risk of developing breast cancer. So green leafy vegetables, lentils, that is the diet which you are supposed to eat. Processed meat, high fat diet increases the risk of breast cancer. Vitamins, ladies who are consistently deficient in vitamin D, vitamin E and A and C, there is a literature search which indicated they have a higher risk of developing breast cancer. Mineral deficiencies also have been linked with increased risk of breast cancer. But that is a law of triviality. I think if we just stick to two things, exercise, lose some weight, and eat balanced diet, which is whole grains, quality meat, salads, and we will be okay. The rest of the supplements and all those things, minerals, vitamins, I think those are trivialities. I don't believe you will get that much benefit from that part. But if you have corrected the first part, then you could talk about fine tuning your diet, fine tuning this part of it is. So lifestyle in nutshell is exercise daily, sleep properly. Now you could ask what's the relationship between sleep and breast cancer? That was the amazing link which we found. Sleep is not a passive process. Sleep is a directly related to your metabolic health and your cardiovascular health. And that's how it leads to chemical changes in the body and produce a lot of risk factors for the breast cancer. In in one of the Indian studies where they use by default they in their diet they're very rich in cumin, turmeric, and all other spices, they found the risk of breast cancer decreases. So lifestyle, clean lifestyle, which we all know, is your best bet to prevent breast cancer going further. Now, let's talk about staging of the breast cancer. And that is what is the main message I have for you on this talk. As we started, the breast cancer starts either from the lobule or the gland or the duct. Say, for example, if you stage zero is you go to your primary care physician or you go any other provider, you get your mammogram done, they found it out, ductal carcinoma, that there are some cancer changes, but they are just limited to the duct. There is nothing going on anywhere in the body. And it's a simple ductal carcinoma, and this has not even gone out of the duct. Then it stays zero. And that is has the prognosis of 99 to 100%. Now let's move forward. If this cancer cell from duct, because there is no, the first stage zero we call ductal carcinoma in situ. There is nothing if it rises from the gland, lobular cancer in situ. Stage one is when the cancer size, the lump with the size which is thing, it is less than 2 centimeters and It's only localized. It has not gone to lymph nodes. That is stage one. Still, prognosis is 98 to 100%. If the size of the tumor has increased, whether it's coming from the duct or the gland, it's between 2 to 5 centimeters, and it has gone to lymph nodes, either in the axilla 1 or 2, or the adjacent lymph node which is supposed to drain, or to distant lymph nodes. That's stage 3. Even now, the breast cancer is very treatable, and the prognosis is only about 90 to 95%. Now, if nothing happened in this, you never went to for any screening, and the first time we diagnosed the breast cancer and it has gone to different organs, your prognosis dropped suddenly to 29%. That is the key component. Even with the palpable lymph lump and you have lymph node positive, you have almost 100% curable rate. So you must not resist screening, because there is not a day in life of a primary care when we don't end up having very difficult conversations. It is your body. You have a right to refuse. Nobody comes or try to take away your autonomy. I'm trying to convince you why you should have this part. So prognosis up to stage 3 is in 90s to 100%. Stage 4 is in 29%. Now we will discuss briefly what are the treatments of breast cancer. Treatments are very simple. If the disease is limited, surgeon goes in, removes that part. They will discuss with you only this part needs to be, the tumor part needs to be removed, or they have to dissect the lymph nodes. That's surgery. They may have to combine it with radiation. Next is they may have to chemo. So these three we all know. But there are two revolutionary things which are happening. Once, if God forbid you have breast cancer, they take your tissue biopsy, and the biopsy, they check for the receptors. Receptors are the target sites where we could direct certain medications to work on it. On the breast cancer, the target sites are whether you have estrogen receptor positive, meaning you have it or you don't have it on the tumor cells. Second, progesterone whether receptor, whether you're positive or negative. Then third is HER receptor positive or negative. If you are positive for these receptors, that provides your oncologist added place to work on to kill it. So that is a good sign if you are positive. Then, so there are a lot of medications that your oncologist will use to hormonally affect your tumor. And then the last one is called the targeted treatments. In your cancer cells, there are a lot of chemicals which express on the surface of the cells, which we call receptors, molecules. We'll keep it simple. So there are 6 different molecular sites or the receptors which has been identified on these tumor cells. And once they get it, they can target monoclonal antibodies which will go to those receptors and they will start killing the cells. See how the treatment has changed. Initially, we were blasting you after surgery. We were blasting you with radiation, then chemo, and then hormones. But now, and then we were depending that these modalities will hit at right place and kill the cancer cells. Now with the targeted treatment, we know cancer cell might be hiding anywhere. We will find them, and they could be a site for destruction by these targeted treatments. It is beautiful to see how much technology, how much science has improved And this is an evolving field. As we go along, there will be more and more medications available, more and more protocols will be available. Even in the advanced age, we will have good prognosis. So I want to make sure we, as primary care, want to catch your disease as stage 0 or 1 or 2, maximum 3, but never on 4. But if, God forbid, you have a stage 4 disease, it's not a last game. Now, with targeted therapies, we should be able to help you with this part. Now, let's wrap up and then I will kind of answer your questions which we have accumulated on this one part. Breast tissue anatomically is a gland and a ductal system surrounded by fat and skin coming through the nipple. We talked about staging, we talked about screening, we talked about risk factors, which are genetic, lifestyle, family history. I have tried to give you a glimpse of all the different screening modalities which are available and grossly what are the different treatment modalities which we could have. Now, let's take the questions from here, like we have compiled this with this background. I think if we do in a question form, it will help us a lot. So, the first question is breast cancer early detection program. That was exactly how the question came. The breast cancer early detection is through mammography, 99% of the time, ultrasound or MRI or 2D mammography, which they all help to screen you and find the disease very early. As I said, mammography radiation exposure is minimal to none. The benefit is significant. Even today, we have a lady who's stage 1, we diagnosed, we were able to find her disease on mammography and she had a biopsy and she has a stage 1 disease and she will have the treatment started tomorrow. That is a blessing. Sometime in medicine, certain things happen and everything feels magical and some unknown hand works. That's how important the cancer detection and early screening is important. Next question is how to lower risk of breast cancer naturally. That's a beautiful question. Breast cancer can be decreased through changing your lifestyle. Lifestyle involves what you eat, your exercise level, your vices, your how much diet you could tweak. Let's elaborate. Diet. As I've alluded in the beginning, balanced diet, which is predominantly plants, legumes, limited whole grains, quality fat, and quality protein, and also above all, the amount, the number of quantity or the number of calories consumed is important. Your BMI, the ratio of height and weight which we drive, BMI, if you're going up, the risk of breast cancer screening or breast cancer diagnosis increases. Exercise directly stimulates your immune system. In your immune system, there is a natural killer cells. They are your scavenger cells. They are circulating in your blood. And once they get activated, they search for any abnormal cell. Remember, cancer doesn't come from outside. Cancer is one of your own cell which has gone crazy and lost the ability to obey the rules and continue to multiply and invade another organs. So these NK cells, find them, kill them. Exercise directly helps with that. Sleep, target to have 7 to 8 hours sleep. Sleep is directly related to your metabolic and cardiovascular health. Once your metabolic health is out of norm, then you will develop high risk for developing the breast cancer. Stress management. Body and mind are connected, and it is proven over and over that you must learn or develop some kind of mindful techniques, meditation, yoga, tai chi, whatever fancy you, you must take care of your mind and come off the roller coaster and enjoy some life. So these next comes your vices. We all know that we shouldn't drink. We all know that we should not smoke. And that is definitely shown. Smoking and drinking are directly related to breast cancer. Next, your food should be nutrition dense, which is provides you with high quality vitamins, minerals, because those vitamin and minerals regulate a lot of chemical processes in the body and prevent cancer. Above all, breast tissue is intended to produce milk for the child. Breastfeeding also decreases future risk of breast cancer. I think if we employ all these techniques, including diet, exercise, balanced nutrition, stress management, sleep, avoid drinking, and stop smoking, it will all help to reduce the risk of breast cancer. Breast cancer genetic screening. Breast cancer, there are gene studies which are available, BRCA1, BRCA2, and now there are a lot of other new molecular markers which are being developed, and they will be available at a very cheap prices. But people who have a family history of breast cancer, they should aim to get these studies done. That way you are screened properly at a proper time. It used to be that we BRCA screening was very expensive and we have to spend a lot of time and effort and money to do that. But now these studies are getting widely covered and they are very easy to get it done. Symptoms of breast cancer in young women. Remember, breast cancer starts as something extraneous. These cells keep on proliferating. The first thing is it gives you mass. Then it can distort the symmetry of your breast tissue. It may be look enlarged, but if it's it you may find skin dimpling. You may find sometime discharge from the breast tissue, sometime blood in the discharge if you have inflammatory cancer. But the most, and then you may find that there are some lymph node enlargements in the axilla. So the symptoms primarily are lump, dimpling of the skin, asymmetry of your breast tissue, and then lumps and bumps in the draining lymph nodes. Next question. Breast cancer support groups for survivors. Absolutely. If social media has done something good, that is these support groups. And these support groups do not exist just to talk. They are really, really powerful organizations. And they do support cancer survivor both mentally, and they have a lot of resources. There are a lot of intelligent people involved in those groups. I was amazed to see the post and the content, and then amount of research papers which were posted in these groups. So if you are one of those person who has this problem, you must join one of these by either a Facebook groups or any of these survivor groups. We at our practice, I'm developing a primary care voice, our own group, where we could have conversation related primary care, primary care. and your common diseases, I would love you to join on Facebook, my Facebook group, the Primary Care Voice. Next question is best diet to prevent breast cancer recurrence. Best diet is diet low in fat, high in vegetables, good source of vitamins, minerals. Those are the things which will help you to prevent the recurrence. If you have gone through the ordeal of fighting your cancer one time, there is no reason all the things which you are under your control you should do. I'll repeat again: diet, primarily balanced, primarily plant based, quality meat, quality fat, good quantity of protein, and pick food which is nutritionally dense, like fruits and vegetables. When we talk about nutritionally dense foods, meaning if you consume 10 gram of some food, how many vitamins, minerals, and fibers is process provides. Then avoid like a plague anything processed and ultra processed and simple sugars. If you do that, you could expect no more recurrence. Next is the breast cancer risk factor after menopause. See, if you look at the history, the breast cancer developing, most of the breast cancers develop after the age of 50. Nature has created a very delicate balance of between all these hormones, and nature is ruthless. Nature has only two purpose: it wants you to procreate and survive of your own. After menopause, there are a lot of hormonal changes which protects you from breast cancer. They go away. Ladies after menopause tend to gain weight. They tend to not exercise, and their diet changes, and all those things combined with hormonal change make you at high risk to develop breast cancer. Next question: advantages of 3D mammograms for breast cancer. In mammogram, you're getting a single dimensional picture. With the 3D mammograms, you're getting three-dimensional picture where radiologist can construct the whole architect of your breast tissue. These technologies are definitely improving, and I truly believe that is the future. But these technologies overread it. It will read certain things which may not be cancerous, but it will read it as cancerous, and you may end up having more biopsies. Till this technology improves, I think mammography is still the gold standard, but 3D definitely provides a better architect and better picture of your breast tissue. If you don't care that you may end up requiring unnecessary biopsies, then probably you should consider it. I always say this decision should not be individual. Talk to your physician. One advantage your primary care has is he not only knows all the technologies which are available in the community, he also knows the skills and the motivation of the radiology centers and hospitals, and they could guide you properly where you will get the best service. Signs of breast cancer that are not lumps. That is a good question. Actually, one I have not covered. Most of the time, breast tissue or breast cancer starts as a lump, starting from breast gland or the ductal system. But sometimes there are breast cancer which are inflammatory, that they don't produce lump, but they produce bloody discharge, or they produce skin changes. It looks like a rash on the breast. And those two are the most common ones which are do not produce lump, but they are very aggressive breast cancers. So if you have a persistent rash, especially around nipples, or you have a bloody discharge without any reason, or any persistent discharge without any reason, you must consider getting screening done and talk to your physician. Next question is mammographic frequencies for women over the age 50. It is very clear. According to it will depend on, I just want to have a disclaimer. As a primary care, we follow United States Preventive Task Force guidelines. According to them, between the age of 50 to 74, if your mammogram was normal every 2 years, there is no evidence of doing it more frequently. Your radiologist will use American College of Radiology guidelines. Your oncologist will use American their society guidelines. So everybody is trying to screen you, but I believe personally that United States Preventive Task Force guidelines are more evidence based and free from any kind of business uh, effect because they're not trying to generate a business for oncologists. It's like, so I truly believe if we stick to United States Preventive Task Force, which is every 2 years, will be very safe. And the guidelines keep on changing. It used to be that United States Preventive Task Force did not recommend any mammography done below the age of 50. But now, because the evidence is showing that there is breast cancer is developing in 40s, so they change their guidelines. So that is the irony. Medicine is not a fix. What we are talking about today, next year the guidelines may be altogether different. So my request is talk to your primary care physician and always stick to the current guidelines. Latest treatment for metastatic breast cancer. Remember, we just now went over the treatment modalities for breast cancer are surgery, radiation, chemo, hormones, and target therapies. For metastatic breast cancer, the targeted treatment is the best opportunities because in this case, we know the markers of the cancer cell and we send monoclonal antibodies which circulate through your blood and they find those cancer cells and kill them. And they are getting very, very effective. And this is a question which primarily, if you unfortunately have a metastatic breast cancer, you should talk to your oncologist. I think it's above this question. I've tried to answer it as general, but it's above the pay grade of a primary care physician. Next question is preventing breast cancer through lifestyle changes. I think we have gone through this question many times, but I'll repeat again. The lifestyle changes you need to do is lose body fat, balanced diet, which is low in fat, quality meat, quality protein, and ton of vegetables. Nutritionally dense with high amount of vitamins and minerals. Exercise, sleep well, manage your stress. Next question, breast cancer clinical trials, WHO. Again, you could go to WHO site and you could find all the latest trials. But I think if you want to enroll in one of these trials, you should talk to your oncologist, not primary care physician, because your oncologist is in a best position to answer this question very effectively. Next question, best breast cancer screening guidelines for 2024. Between the age of 40 to 49, you should talk to your primary care physician. You both should discuss your risk factors based on your family history, based on your genetic profile, and your lifestyle, and you could plan accordingly. And it should be a shared decision. After the age of 50 to 74, every 2 years, And after the age of 74, there is no evidence that screening will help to find it early enough to either make you live long or improve quality of your life. Next question is why we celebrate National Mammography Awareness Day. As I said, third Friday in October is National Mammography Awareness Day. The goal is to increase the number of mammograms done, teach ladies, show them that it is a very harmless procedure. And a lot of our patients have very dogmatic view of that and they do not want to get these things done. But I truly believe the push for these tests will help you a lot. Next question. What type of breast cancer do I have? How does it affect the treatment? See, I will, I'm not an oncologist. I will keep it simple. Breast cancer can be either coming from your duct or coming from the gland. And the treatment and how big the size is at the time of diagnosis, then are they removed, and how many lymph nodes are involved, and based on whether it's gone to other places or not, will determine the treatment options. The staging, which I went from 0 to stage 4, that will be done by your oncologist and they will plan and discuss the treatment. What is the stage? Next question is what is the stage of my breast cancer and what does it mean to my prognosis? I will explain that again because that is the core message. Stage 0 is a just in the duct. That is the best 100%. When the tumor size is less than 2 centimeters and is local, not extending anything, that's stage 1. Stage 2 is between 2 and 5 and the local lymph nodes are enlarged, still almost 100%. Stage 4 is the one where it has gone to different organs. That is where it drops to only 29%. And that is what we want to avoid. What are the chances of my cancer spreading to lymph nodes or other organs? Recurrent rates are, are there. There is a possibility of this thing happening. But this question you should discuss with your oncologist and do that. But if you follow healthy lifestyle, follow your routine screenings, and also you work with your oncologist on ongoing basis for the surveillance, hopefully this will never happen. Next question is genetic testing necessary in my case and how it will affect my treatment? If you don't have a family history, genetic testing can be done, but without family history, the question always comes, you may be the first one who has this problem. So if you diagnose with that, they will do the genetic testing automatically, or you could ask for it. And if you are positive, then your oncologist will plan differently and more aggressively if you are positive for those genes. How is breast cancer detected early and what screening methods are available? Breast cancer is detected early only on mammography or sometime by the ladies themselves. And mammogram is still the best screening test. What is the importance of hormone receptors and HER status in the breast cancer? It provides, once your tumor is positive for these receptors, it provides your oncologist another weapon to fetch your cell and kill them with the targeted medications or affect harmony so that they can stop the growth of these cells. It is a good sign if you are positive. What are the common side for breast cancer treatment like chemotherapy, hormone therapy, and surgery? This is a very loaded question. I think this question should be answered by your oncologist directly. But generally, depending on which medication they are giving you for chemotherapy, you will have treatments. Hormones therapy is basically most of the time they are ablating your hormones and you will develop hormonal deficiency stage. And the surgery, and like any other surgery, could have bleeding, infection, and operative complications. Can breast cancer come back after treatment? How the recurrence is monitored? That's a good question. Yes, recurrence can happen. It is recommended that if you have breast cancer, you should have the screening done by more sensitive test like MRI of the brain. Because MRI, if you have a breast cancer already and you're breast cancer survivor, you want to have a treatment modality, you need to be screened with treatment modality, which will pick up the things very, very early. And the MRI is the best test at this time. How should I manage long-term side effect of breast cancer treatment like lymphedema? Lymphedema is a real problem, and we there are a lot of compression stockings available. And now, in every town, you will find a physical therapist who specializes in lymphedema treatment. And these people, I've found them very, very passionate. They understand your problem and they work very, very closely. So you should look for physical therapist who has special interest in lymphedema, and usually your oncology centers will have the resources. How does age and family history affect the risk of developing breast cancer? Elderly and family history is a negative, meaning you are at increased risk of developing breast cancer. But if you live clean life, it should not be a problem going aging into later stages of your life. What lifestyle changes can reduce the risk of breast cancer? Again, exercise, losing weight, sleeping, managing stress, and nutritionally dense foods. What are the treatment options for metastatic breast cancer? This question should be to the oncologist, but as a rule of thumb, with the newer targeted therapies, it is becoming very feasible to treat this breast cancer even at later stage. What clinical trials are available on my type of breast cancer? This question, I'm not sure I could answer or I'm qualified to answer this question. How do different breast reconstruction options compare with after mastectomy? As for my experience is the ladies who go through reconstruction, they pretty much can have the same contour and anatomically restored the same way. The physicians who does this kind of work, they are very, very skilled. And unless you tell yourself, it's very rarely you will be able to find that you had mastectomy. Last question. What financial sources are available to cover my breast cancer treatment? Again, this question is about my pay grade, but your most of the insurances, if you have, will cover it. If you don't have insurance, look for Medicaid and lot of community resources, church resources are available. In every town, there is a free clinic available who will see those patients on pro bono. I guess I think I have answered all your questions. If there is any question, please write in the comment and I will answer them. My goal in this discussion was to convince you get your mammography done, ensure that we diagnose your disease at early stage and you are 100% protected. Improve your diet, lower your risk factors. We will in the link our other videos on breast cancer. From that way you could get more educated about that. There is a video which I will link where we have gone through the whole journey of somebody who gets diagnosed with breast cancer. I hope I've convinced you enough that you will get your mammography done. Between the age of 40 to 49 is a shared decision. Between 50 to 74 every 2 years. And after 74, there is no evidence of continue doing mammography. Let's all use this month. There are a lot of resources available. Let's get the mammography done, get screened, and let's diagnose, God forbid, if you have this disease at an early stage. Thank you very much. I will see you next video, and please watch this playlist. You will learn some new things. Thank you very much.